Hello, gentlemen. If you're over the age of 50, 60, or even older, and you've recently noticed that intimacy no longer feels quite the same, especially if you experience the pleasure of climax without any noticeable release of semen, then this conversation is for you. Perhaps it happened once and immediately filled you with concern. Or maybe it has become something you quietly live with, wondering if it's a sign that something is seriously wrong. I'm Dr. Leah, and for years I've dedicated my work to helping men understand the health changes that come with aging. The first thing I want you to know is this: what you're experiencing does not define your masculinity or mean your intimate life has come to an end. Instead, it's your body's way of communicating that something has changed. Together, we'll explore the possible causes, warning signs, and practical medical solutions that can help restore confidence and peace. Before we examine why this happens, it's helpful to understand how ejaculation normally works. Imagine your reproductive system as a perfectly coordinated team where every part performs its role at exactly the right moment. The testicles produce sperm, the seminal vesicles supply most of the nourishing fluid, and the prostate contributes additional protective secretions. These components combine inside the urethra, preparing for release. During climax, powerful muscle contractions work together with nerves and glands to push the fluid outward in a smooth, rapid process. Here's something many men don't realize. Orgasm and ejaculation are two separate events. An orgasm is the intense feeling of pleasure created by your brain and nervous system, while ejaculation is the physical release of semen. They usually occur together, but they rely on different biological mechanisms. When pleasure remains but semen is absent, doctors call this dry ejaculation, and it often has a clear medical explanation rather than a mysterious cause. Many men describe dry ejaculation as an unsettling experience because they expect to see a physical sign that matches the sensation they feel. When that sign is missing, it's easy to assume the worst. However, the absence of semen does not automatically mean you've lost your sexual function or vitality. In most cases, your nerves are still creating the pleasurable sensation of orgasm exactly as they should. The difference lies in the physical pathway responsible for transporting the fluid. In other words, the experience of climax and the movement of semen can become separated for very specific medical reasons. Before we look at the most common causes, I'd like to ask a quick favor. If you appreciate honest, evidence-based men's health information, please take a moment to like this video and subscribe to the channel. Also, leave a comment below telling me where you're watching from. I always enjoy seeing our community continue to grow together worldwide. The first and most common reason for dry ejaculation is a condition known as retrograde ejaculation. Although the name sounds alarming, the explanation is surprisingly simple. At the entrance to your bladder is a small circular muscle that normally closes tightly during ejaculation. Its job is to keep semen moving forward and out through the penis. When this muscle doesn't close completely, the semen follows the easier path and flows backward into the bladder instead. You still experience the full sensation of orgasm, but little or no semen is released externally. One clue is that your urine may appear cloudy the next time you use the bathroom because the semen mixes harmlessly with it. This condition often develops after prostate or bladder surgery, or as a side effect of certain medications used for enlarged prostate or high blood pressure. Fortunately, understanding the cause usually brings reassurance and opens the door to appropriate treatment. Another possible explanation is a blockage somewhere along the pathway that carries seminal fluid. Think of the reproductive tract as a network of narrow pipes. Even when the glands continue producing fluid normally, a blockage can prevent it from reaching its destination. Scar tissue left behind after severe infections, long-standing inflammation of the prostate, or in some cases, tiny mineral deposits, can partially or completely obstruct these delicate channels. As a result, the amount of semen released gradually becomes much smaller or may disappear altogether. Some men also notice a mild aching sensation in the pelvic area during climax, or realize that the volume of semen has steadily decreased over several months. The encouraging news is that many of these obstructions can be identified through proper medical evaluation. Depending on the underlying cause, treatment may involve medication to reduce inflammation or minimally invasive procedures designed to restore normal flow and improve reproductive function safely. The third major cause doctors investigate involves your hormone levels, particularly testosterone. This hormone plays a much larger role than simply supporting sexual desire. It helps the prostate and seminal vesicles function properly, allowing them to produce most of the fluid released during ejaculation. When testosterone levels decline significantly, the entire reproductive system becomes less active. Many men first notice a reduced amount of semen, but over time they may also experience a lower sex drive, weaker erections, and orgasms that feel less intense than before. Outside the bedroom, symptoms often include ongoing fatigue, reduced muscle strength, mood changes, and a noticeable drop in overall energy. These changes should never be dismissed as an unavoidable part of aging. A simple blood test can determine whether a hormonal imbalance is present. If confirmed, appropriate medical treatment may help restore hormone balance, improve sexual function, increase energy, and enhance overall quality of life. Although the causes we've discussed are often treatable, there are situations where dry ejaculation deserves immediate medical attention. If it begins suddenly without an obvious reason, especially when accompanied by pain, blood in the urine or semen, fever, numbness, or loss of sensation around the genital area, you should arrange a prompt evaluation with a urologist. These symptoms may point to conditions that require timely diagnosis rather than watchful waiting. In some men, long-term uncontrolled diabetes can damage the nerves involved in ejaculation. Certain neurological disorders may also interfere with the signals that coordinate the process. Less commonly, abnormalities involving the prostate or urinary tract can produce similar symptoms. The important message is not to panic, but not to ignore the warning signs either. Seeking medical advice early gives you the best opportunity to identify the cause, begin appropriate treatment, protect your overall health, and regain confidence with peace of mind. Beyond the physical changes, dry ejaculation can have a significant emotional impact that many men rarely discuss. For years, many have associated the presence of semen with masculinity, sexual ability, and confidence. When that familiar experience changes, feelings of uncertainty, embarrassment, or even inadequacy can quietly develop. Some men begin avoiding intimacy because they worry about disappointing their partner or fear being judged. Over time, that silence can create unnecessary distance in relationships and increase anxiety. The truth is that your value as a man is not measured by the amount of fluid released during climax. Your capacity for intimacy, emotional connection, and sexual pleasure can remain strong despite this condition. The first step toward rebuilding confidence is understanding that dry ejaculation is a medical issue, not a personal failure. Open conversations with your healthcare provider and your partner often bring reassurance, reduce fear, and lead to effective solutions that restore both confidence and peace. As we come toward the end of this discussion, I want to leave you with a practical plan you can begin following today. The first step is simple. Don't ignore the change. Whether dry ejaculation appeared suddenly or has gradually developed over time, schedule an appointment with a qualified urologist. In many cases, a detailed medical history, physical examination, and a few routine laboratory tests are enough to identify the underlying cause. Next, take control of the health conditions that commonly affect sexual function. Properly managing diabetes, high blood pressure, elevated cholesterol, and excess weight helps protect the nerves and blood vessels responsible for normal ejaculation. Finally, stop carrying this burden alone. Speak honestly with your partner and your healthcare provider about what you're experiencing. Open communication removes unnecessary fear, strengthens relationships, and allows you to receive the most appropriate treatment. Taking action early often leads to the best possible long-term outcome. In closing, remember that dry ejaculation is not a verdict on your masculinity or a sign that your intimate life is over. Instead, it is a message from your body that deserves attention, understanding, and, when necessary, professional evaluation. Whether the cause is related to the flow of semen, a hormonal imbalance, medication, or another medical condition, identifying the reason is the first step toward finding the right solution. Throughout my years educating and supporting men, I've seen many regain their confidence simply by seeking answers instead of living with fear and uncertainty. Your vitality is measured by far more than the presence of seminal fluid. It is reflected in your overall health, emotional well-being, meaningful relationships, and quality of life. Never allow embarrassment or outdated beliefs to keep you from getting the care you deserve. With the right guidance, you can continue enjoying a healthy, confident, and fulfilling life for many years ahead.